so much for having me. First of all, I am the lead pharmacy technician. I didn't start there. I started as a regular pharmacy technician. I started in retail, and I worked my way up, and I went to the hospital and worked in the hospital for a little while, and then became a lead technician. So it can happen. You can grow as a pharmacy technician and make your career as a pharmacy technician. But you've got to start somewhere. So count, weigh, measure, dispense, repeat. To some, that's all a pharmacy technician does. However, it doesn't matter what others think. The danger and sadness occurs when the pharmacy technician believes that also. Accuracy, attention to detail, and accountability are important, but not most important. What's most important? The patients. There are many different places where you can work as a pharmacy technician: nursing homes, compounding facilities, mail order, retail, and hospital, just to name a few. Like I said, I'm going to speak of the ones that I know best: retail and hospital. In the retail setting, you'll most often be the face of pharmacy. Keep in mind, most of the patients you'll be dealing with are either sick or in pain or worried about the family member or the loved one who is. Understanding this fact will help you when you're dealing with the patient. You will most often be the one to process their prescription. This can be, in its own, give you the most challenges. If you don't already know this, doctors are not really known for doing very good handwriting. Even on something as important as a prescription. If the prescription is unclear, you may have to ask the pharmacist to read it. If they can't, you may have to contact the doctor's office to verify the prescription. Oops, got to answer the phone. Once you're sure the prescription, you normally process the patient's insurance. Don't forget to answer the phone. You may require a phone call to the insurance company. Retrieve the medicine from the shelf. Oh, answer the phone. Count out the medicine, getting it ready for the pharmacist to check. Don't forget to answer the phone. Then after it's checked, you receive payment and wish the patient well. You must build an instant rapport through kindness and empathy. From that rapport comes trust. Over time, with regular patients, that trust will grow into a professional relationship filled with trust, courtesy, kindness, and even humor. I cannot count the times that I've listened to a patient, empathized, or simply smiled at a patient, and seen visible or audible proof that I, in some small way, made a positive impact on them. Knowing that you can get through the rough and a monotonous day. I also cannot count the number of times in a retail setting that a happy patient has lifted my mood or brightened my day. Those times can be very rewarding. I'm reminded of a specific patient. I'll call them Mr. and Mrs. Jones. Mrs. Jones comes to the pharmacy and loves to tell me about her 3 grandchildren. She feels comfortable to ask the pharmacist about her medicine. She loves to talk about her grandchildren. I love it when she comes by, and one day she asked me for her help. She confided in me that Mr. Jones has the beginning of onset Alzheimer's. And when he comes into the store and he gets confused, can he ask for my help? I, of course, said yes. And there have been many times that he's come and asked for me. Simple things. Can he help me find some eye drops? Can he help me get the cat litter? Can he help me get something else? I stop whatever I'm doing and I go and help him. Because I have built a rapport with this couple and they come to the pharmacy for our help. I still enjoy Mrs. Jones' talks, and I enjoy listening about her grandchildren. That's all part of the rapport I've built, and one of the most rewarding aspects of my job. In the hospital setting, the patient is still most important. Most hospital patients give little or no thought at all to what a pharmacy technician does. The doctor prescribes the medication, the nurse administers them, and that's all, as far as the patient is concerned. However, a duty exists. And though the patient does not fully understand the process, they rely on that duty and on us to perform that duty. accurately and responsibly. The gratification comes from your own personal knowledge of a job well done accurately, precisely, timely, especially when you have a staff order that's expected to be done on time. There is little glory for a pharmacy tech in hospital settings. Rarely, if ever, a patient or a patient's family thank a pharmacy technician for helping them. The glory belongs to the doctor, and to a lesser degree, even the nurses. I'm in no way saying that they're undeserving. Please don't misunderstand. Doctors and nurses work hard for their patients. As pharmacy techs, we play a role in the treatment of patients, but our role is more behind the scenes. The doctors and nurses rely on us. They rely on our accuracy to allow them to do what they do. Think of us as support troops. Just like a combat soldier who can't fight without bullets. He can't fight without the right bullets in the hands of the right soldiers at the right time. We have to get the right medicine at the right place, at the right time, so the doctors and nurses can fight the pain, can fight the disease, or fight the illness of the patients. So the most important thing, be accurate, be accountable, pay attention to detail. Don't try to take shortcuts. These apply to your technical aspects of your job, but never ever forget the patients. They're always most important.
Thank you so much.